someone's going to get blockchain plus healthcare right, and it's going to be worth $1 billion without a doubt. The healthcare industry is one of the biggest money-making industries in the world ever. Look, you've got a problem, how about we sell you a pill? They don't want to fix it, they want to treat it. There's not enough money in the cure, there's a lot more money in the treatment, right? It's a sad reality of our world, and a lot of people don't want to acknowledge it, but that's just the fact of the matter, okay? And let me touch one more thing real quick. Okay, so if the government can print as much money as they want and they choose to continue to do so, right? Why do we pay taxes? Paying taxes is miserable, not even just from the fact that, you've got to give up some of your money and whatever else, right? So how about just the fact that doing your taxes sucks? And the tax code is so convoluted that you need to hire a professional to do something you are mandated to do. Why can't we spend time simplifying the tax code? But again, if the whole point of taxes was to basically contribute to the government, but they just operate in permanent debt, and yet they can still print as much money as they want to, yeah, anyway. So today we're going to be looking at healthcare plus blockchain and a new project, a new investment opportunity, as always not financial advice though, that can give us exposure to the healthcare plus blockchain industry, because the fact remains that healthcare is not going away and there's a lot of money to be made there. Previously hard to get exposure to it though. Before that though, I'm going to expose you to Tails, our resident Shiba Inu, our CHO, our Chief Health Officer here at the VoskCoin YouTube channel. My name is Vosk. Make sure to slap the subscribe button and let's jump into another fun video. Healthcare plus blockchain. There's a huge use case there, but instead of me just sitting here and talking a bunch, let's pull some top results off of Google. So how about 5 blockchain healthcare use cases? Digital health, supply chain transparency. Major challenge across the healthcare sector, as in many others, ensuring the provenance of medical goods to confirm their authenticity. So the key benefits of blockchain paired with AI, artificial intelligence. Customer confidence, ability for the customer to track each package's end-to-end provenance. Compliance, medical device manufacturers and pharmaceuticals face high reporting burdens. This could help with that. Supply chain optimization. Number 2, patient-centric electronic health records. Okay, so Johns Hopkins research on medical errors as a proportion of annual deaths in the US. So medical error, 250,000. That's a lot. Okay, better records definitely help with that. Smart contracts for insurance and supply chain settlements. Companies such as Chronicle and Curasium provide blockchain-based systems where various players in the healthcare sector, such as pharmaceutical companies, medical device OEMs, wholesalers, insurers, and healthcare providers, can authenticate their identities as organizations. Similarly, shared smart contracts can be used to manage medical insurance contracts for patients. And smart contracts are basically decentralized applications. Their possibility for use is nearly boundless. So there's so many things we possibly haven't really even thought of yet, let alone built out, right? Medical staff credential verification, IoT security for remote monitoring. That's a cool and fun and interesting use case here. Imagine helium, right? Internet of Things, building out a network, being rewarded in HNT coins, right? But merging it with the healthcare sector instead of helium's use case. There are huge companies building for blockchain. It's really no surprise, right? But one of those would be IBM. They are working on blockchain utilization for many things. Monetization opportunities, takeout, risk mitigation, supply chain, digital identity and credentials, digital assets. They even have a whole tab on how they're looking to build out and support the healthcare industry. So this stuff is coming. It's not a matter of maybe. Okay, this is just absolutely happening, right? Benefits data integrity across multiple parties, full traceability, new operational efficiencies. Enter today's video sponsor would be Galeon. And this is a new opportunity where we could get investing exposure to blockchain as well as healthcare. So their use case here, support medical research, connecting hospitals, patients, and caregivers for the good of humanity. They want to build the future of health, electronic health record, top quality structured medical data. Medical research meets blockchain. The Galeon DAO, that's a decentralized autonomous organization, represents patients worldwide and supports medical research by funding nonprofit projects with major impact for the good of humanity. It operates as a DAO on the blockchain to empower patients and holders of the Galeon cryptocurrency. They have the power to decide what will be the next healthcare discovery. Honestly, it's pretty interesting. It's weird. It's different. Never before in the history of our lifetime have we been able to do anything even close to this. Cryptocurrency and blockchain is enabling that and just making it all possible. They are currently hosting an ICO. It's an initial coin offering, like a token sale. So you can register for the ICO if you'd like to do so. Unfortunately, due to regulatory reasons, you cannot invest in this ICO if you want to, and you're from one of these countries. Let me just name off some of these real quick. North Korea, Cuba, United States, commonly grouped together because the United States is ran by a bunch of idiots, to put that nicely. It's ridiculous. It's just, I'm so tired of this. So there is a KYC, know your customer aspect here. So this isn't something you're going to be able to get around, but this is a token. It'll be traded on decentralized exchanges. It'll be picked up by centralized exchanges that may serve U.S. citizens. So we will get the opportunity to invest in this in the future. I speak from the point of view of being a U.S. citizen, but as it stands, we will not be getting that opportunity, unfortunately. Not trying to be a total buzzkill here though, so let's run through their light paper. This will be an ERC20 token and a BEP20 token. That means it'll be on the Ethereum and Binance Smart Chain blockchains, which means, again, this will be traded on decentralized exchanges. Uniswap, SushiSwap, obviously PancakeSwap on BSC. Opportunities here: healthcare data monetization, project accelerator good for humanity with their Galeon token. Means of payment: hospitals that deploy Galeon Care Cloud will pay part of their services in the Galeon token. These tokens will be destroyed, buy back and burn. It makes this a deflationary token, which is an interesting play, especially with a DAO. Obviously, it's built to incentivize, the early investors and get a return on their investment here. But I think they would be better off with a fixed supply, personally. But maybe I'm like a crypto boomer compared to everybody wants their token to be deflationary these days because they think it's that simple that's going to send it up. Right? They have public team members on their team, doctors, okay, among many other team members here. Public facing, you can research them, you can learn more about them, you can join their community. We've talked about Quentin before. He's the one who connected us with Galeon to make today's video possible. He leads marketing on some very interesting projects. As a reminder, this project is based out of France, right? This is a French project. Obviously, global expansion and adoption is, of course, the goal here. Billions and trillions of dollars spent. We know that 65% of doctors, per their data, use software daily. 71% of patients have a smartphone. So basically 70% of the clientele is there as it stands. And we're only becoming a more smartphone-enabled, software-driven society every single day. And what takes Galeon from more than just an idea to actually being used, the pilot program, things like that, things that add a lot of value and potential just trust here that they're actually going to get anything done, because most new projects, most new companies all fail statistically. Okay, key figures here: $600,000 revenue to date, 90,000 patient records, 3 hospitals in deployment, over 100 quality indicators updated in real time, 9.5 caregiver satisfaction score, and over 500 contributing caregivers. Dr. Hamdi makes a good pitch for them here. The time we save will save for the patient. Basically, you are speeding up the hospital, which also makes them more money, saves them money, but also speeds up the experience for the potential users or gets them in quicker due to efficiency. So it's kind of a benefit across the board, even if it's obviously geared and marketed and made towards the actual hospital, right? You have a well-oiled machine, you're gonna have better performance, simple as that. So that's our overview of Galeon and looking at blockchain in the healthcare industry. I mean, I'm not trying to sound shilly or like I'm paid to say this, right? But it's there. The use case is there. I mean, why do you think IBM is building it out? You think that they're an absolute powerhouse, just as a global company by accident? All right, they've been building it out for years. There's other competitors. It's an absolute market here. Someone's going to do it. Someone's going to get it right, and they're going to be worth a lot. Will it be Galeon? Well, it's up to Galeon to actually make some things happen and get it done. But one thing I can say for sure is a simple fact that they're here, they're launching, they're trying. Just like you should be trying to get your finger over there to the mouse, to smash that subscribe button, click the thumbs up, leave a comment, let me know your thoughts on Galeon today's video and what you want to see us cover next. As always, seriously, thanks so much for watching. We're uploading daily. I'll see you tomorrow. Watch out for scammers impersonating us in the comments. I'm not on WhatsApp. I hate WhatsApp. Goodbye. Please be advised, there are scammers impersonating us on multiple platforms. I don't want your money, I just want you to smash that subscribe button. Everything in this video is for entertainment purposes only. That means it's not financial advice.